Hello YouTube, welcome to Dr. Vibes, a learning point. In this video, we will study about jugular venous pressure, that is JVP. Now first you have to understand why are we taking the pressure in the jugular vein. I can take femoral venous pressure also. I can measure the pressure in the superior vena cava also. Why jugular vein? So basically, jugular vein pressure tells us about the pressure in the right atrium. Why? Because right atrium is connected to superior vena cava, inferior vena cava, and superior vena cava on the upper side is made up of brachiocephalic vein, and this brachiocephalic vein is made up of internal jugular and subclavian vein. Now subclavian vein has a 90-degree entry to the superior vena cava, but jugular venous pressure has a horizontal entry, that is straight entry. So calculation of pressure in that vein is easier, and indirectly the pressure in the jugular vein will tell us the pressure in the right atrium, and we are interested in the pressure of the right atrium. Okay, so this is the significance of taking jugular venous pressure. Now which jugular vein, internal or external? So basically internal jugular vein and subclavian vein forms the brachiocephalic vein, which forms the superior vena cava, but here internal jugular vein is very deep inside, so you will not be able to elicit it properly. Hence we usually take it in the external jugular vein. But ideally, it should be the internal jugular vein, correct? Now you have to know the different waves of JVP. See, this is the A wave, which you can see in most of the books. This is the X. This is X descent. Then this is a C wave. Then there is X dash descent. Then there is a V wave, and then there is a Y descent. So 3 ascent, 3 descent. A, C, V are the 3 ascent. X, X dash, and Y are the 3 descent. Now, as I've told you, the jugular venous pressure is measuring the pressure in the right atrium. So everything will be related to the right atrium. So if the pressure is increasing, that means it shows atrial contraction. X, that means atrial relaxation, which is denoted by this descent. Now when the atria has relaxed, all the blood has gone to the right ventricle. Now you will see that this is the tricuspid valve. This will bulge out because the blood is filled in the right atrium. So this bulging will again increase the pressure in the jugular vein. So bulging of the tricuspid valve will lead to the C wave. Now, here you have the chorda tendineae fibers. This will try to bring back the tricuspid valve in its original position like this. So you will see that there is a pulling of the tricuspid valve into the original position. Hence you can see the X descent, X descent. Now, when there is increase in the venous return, then the blood will come through the superior vena cava, through the inferior vena cava. Again this right atrium gets filled with blood. So you see the V ascent, that is the atrial filling due to increased venous return. And lastly, again the right atrium will empty all its blood into the right ventricle, that you can see by the Y descent, RA emptying into the right ventricle. So these are the waves of JVP and their significance in a physiological condition. In next video, we will see the pathological significance of JVP.